Welcome to Something to Talk About from the Bainbridge Island Senior Community Center. We offer programs Monday, Wednesday, and Friday at 1:30. Check out our calendar at biseniorcenter.org/calendar to see what's coming up. And we would like to thank Fieldstone Communities of Bainbridge Island, which offers memory care. They're building assisted living and independent living facilities here on Rolling Bay, and they are accepting residents. So to learn more or to find out about their day stay or respite programs, call 360-689-4314. And we make a point of acknowledging whenever we meet that we are meeting on the ancestral homelands of the Suquamish people, the people of the clear salt water, who've lived on these waters of the Salish Sea since time immemorial. We honor their protection of these properties, these waters, and we are grateful for their hospitality to those of us who came later. Today, we're going to be talking about Medicare, and it's a complicated operation, especially when you're just getting introduced to it. And Elmarie Anderson of the Peninsula Community Health Services is with us. Elmarie is a SHIBA volunteer, and we'll get into what that means in a minute. The Community Health Service offers a variety of things outside of just straight medical support, which is a wonderful thing, as they are, I believe, a nonprofit organization, and they do a lot to help our community. And one of those things is helping with getting people introduced to Medicare services. So, Elmarie, thank you for joining us, and tell us a little bit about what SHIBA means and sort of what kinds of help you as a SHIBA expert can offer.
Thank you very much, Reed, for that introduction. So SHIBA is actually, it stands for Statewide Health Insurance Benefit Advisors, and it is a free program under the Office of the Insurance Commissioner of Washington State, and we provide free and biased information about healthcare coverage and access for people and Washington residents. What we can do as a SHIBA representative is discuss Medicare options, and we can also help people compare plans through the main website of Medicare's website. And so we also do assessments too as well for people who are limited in income and resources, and see what kind of programs that can help them with the cost of their coverage. So there's a few things as a SHIBA representatives that we do. We can meet people one-on-one. We go out to the community a lot and do a lot of outreaches like tabling. We do hold a lot of Medicare presentations in the community to talk about the different parts of Medicare, a little bit about what is provided under those parts, and to share information about how to sign up and when to sign up for Medicare.
Okay, yeah, I know that Medicare is tied in some ways to Social Security. You have to get set up with Social Security to get set up with Medicare. And there's, of course, increasingly all this online activity that you have to do, which for some of us who are just getting at the Medicare age, it's a little daunting.
Yes, so some people can actually get signed up automatically. So for those who are already receiving their Social Security retirement, or if somebody has been on a disability with Social Security getting SSDI, and they've been on it for 24 months, those people are automatically enrolled in Medicare. Now, for everyone else, they have to actively enroll by contacting the Social Security, and really, they're the ones who are going to determine how much you pay in your premiums. Because they do look at your tax return information 2 years prior to you turning 65, and then that's how they determine your Part B premium. And if you had worked more than 10 years, in most cases, you can get Part A premium free. And if not, then the Social Security will also be able to generate how much you would pay for Part A as well.
So we're already starting to get into the alphabet. So can you just sort of walk through a little bit about the different components? And I know that there's the wrinkle of original Medicare and then Advantage, but let's try to sort of sort these out a little bit just on the front end.
Okay, so there's 4 different parts of Medicare that people just need to keep in mind. Part A is the hospital insurance, Part B is the medical insurance, Part D is the prescription drug coverage, and Part C, which is also known as Advantage plans, that is more like a wraparound service where you can get A, B, in most cases they do have D in it, and sometimes they can have coverages or benefits to what original Medicare actually doesn't cover, like routine hearing, vision, and dental.
And then in addition, there's a supplemental if you're using original Medicare, right? Can you say
Yes.
something about how that works?
So the supplemental only goes with original Medicare. And what that just means is that it's a secondary payer to Medicare. It's an addition to it. And we do call them Medigaps because they pay into the gaps of Part A and Part B. So with a Medigap policy, if it is actually illegal to sell a Medigap policy to someone who's already on an Advantage plan. So, and they do have certain enrollment times that give them a guaranteed right to purchase. And if they miss that, they could always try, and usually it's a 6-month period. And if they try after that, they may have a hard time getting on. The plans can always deny selling for no reason at all.
Okay, so when you're saying that, we're talking about the supplemental, which
Yes.
you're on original Medicare and you're trying to get a secondary insurer for the stuff that Medicare won't cover. And
Mhm.
you're saying there's a 6-month window. Is that at the beginning of when my eligibility is?
Yes, that is correct.
So let's
So-
say I'm turning 65 and I have 6 months after my eligibility period to sign up without question for a supplemental. But if I let that time lapse, then I might need to be qualified. Is that what you're saying?
Yep, so it would be a 6-month period when your A and B are actually active. So if you're signing up and you're turning 65 next month, then you have 6 months as of next month to sign up for that Medigap with that guaranteed right to purchase that they have to sell you a plan.
Now, is that true if I'm older, but I'm just now switching to Medicare? Same thing. Do I still have 6 months?
So if you're older because you've been actively working, you do get a special enrollment period after you stop working or you lose your insurance, your group health insurance. And whichever one comes first, that's when you should actually start, go by that date. So you do get a special enrollment period, and that does give you a guaranteed right to purchase for those Medigap plans.
Okay. And
My understanding is that
Roy,
also,
go ahead, Roy. Sorry.
yeah, because that applies to me, and my understanding is, again, it's 6 months from
Yes.
when my employee provided health benefits stop.
So what it is your special enrollment starts at that period. So you do have an 8th month special enrollment period to finally sign up for Part B. Now, when your B is active and because you've probably been on A, because if you get it for free, and then you later on sign up for B, when your B is active, then you have 6 months from that time frame to sign up with a Medigap plan.
Good.
Is that a little bit more clear?
Yeah, well, I again, it was a question I had, and I did get that answered in earlier research, so.
Okay.
Yeah, so there is that, and it sounds like what you're saying, Elmarie, is even if you have insurance that's going to follow after you retire, the sooner you start to work on this, the better.
Yes, and so one thing to also keep in mind is that if you are going to have any other supplementary plans like a retiree plan, you actually may not need a Medigap plan. You might end up saving yourself some money and keeping your Medicare and your retiree plan. So when somebody is going to retire and they have a plan, it's always best that they speak with their benefit administrator so they can learn how they'll work with Medicare, if any of the coverage is going to change for them, if they definitely have to enroll in Part A and B to keep it. So there's just a lot of things that they can talk to with their benefit administrator and if it will even benefit them to get a Medigap or to just stay with their retiree plan.
So I have a question about what you as a state health insurance benefit advisor can do. You can help sort of identify a situation like this and say, in your particular case, it probably makes sense to go to your company's benefit official. Or if I'm in another situation, you can kind of say, oh, you might qualify for additional help with your premiums. And so you want to check on that. So you're
Yeah.
kind of a navigator more than actually selling or signing up any actual insurance programs. Is that
Well,
right?
we do actually help people sign up for plans and help them enroll. So when somebody gets their Medicare card in the mail and they're ready to sign up for plans and they know which way they want to go, what we do as a SHIBA representative is we can help them look and compare Part D plans, and we can also help them look and compare Advantage plans. And then
Okay,
we
so
can provide a listing of the Medigap policies and explain it to them and how they can sign up for that.
and then we have an annual open enrollment period as Medicare insured people, right?
Yes, that is correct. So the annual or the open enrollment period is October 15th to December 7th.
And what kinds of things can we change at that point?
So anyone on Medicare can make changes during this time. So you can make changes to your drug plan. You can make changes to your Advantage plan. You can switch to original Medicare, or you can switch from original Medicare to an Advantage plan.
Okay, and in your experience, are there people who it benefits to make changes after the first year, that it's good to check in every year?
Definitely. We always encourage people to always look what's out there for the next year to see if they can save themselves some money. Sometimes plans change. Sometimes the prices change. So it's always good to look, even if maybe they might not want to change, but at least they took a look at what's out there and if they could save themselves some money. And then one thing to keep in mind too is if somebody is taking prescription medication, sometimes plans change their formulary. So it's always good to also look at that and make sure they're listing their medications when they're searching for their plans.
Now that's a 50-cent word, a formulary. What does that mean?
So basically, it's just like a listing of all the medication that the plan is going to cover. So they all have their listings. They have so the way that somebody can find out if their medication is on that formulary or the listing for the plan, usually we use Medicare.gov, which is their official site. We list their medication, and then when we're searching for plans, it will let us know if it's on the formulary, what tier it is on, whether it's like a generic drug, a brand name, and how it's going to cover it, and then how much they'll actually pay when they're refilling the medication.
And as you say, I've heard that can change quite a bit from year to year, given each plan. So what might be a good plan, Part D insurance one year, is not so good for you, depending on what drugs you need to take every year, every month.
Yes, that could be the case. So that's why we always encourage people to look every year what's out there and see if they can save themselves some money by looking.
So I'm wondering if there are some common questions that you get when people are starting to just go down this road. Maybe we've touched on them already, but I'm just curious if there are some things that you often find yourself answering.
Yep, I definitely find myself answering to a lot of dental questions. So people who have original Medicare, they can sign up for any dental plan out there that's willing to sell them, because CMS, the Centers for Medicare and Medicaid, don't regulate those plans. So they can definitely look for a dental plan. Now, also, I find myself explaining a lot that even if somebody does have an Advantage plan that includes dental benefits, a lot of those plans, they do have a benefit limit for a year. So sometimes a plan can offer $1,500, sometimes it can offer $2,000, sometimes it can offer $4,000 for a year. And there may be some services that it won't include to cover. So when somebody is looking for dental benefits, it is very tricky. Also, people who are on an Advantage plan and they do have a dental benefit, they have been asked, I've gotten this question recently so far pretty often, is that can they sign up for a separate dental plan as well? So the question, I mean, the answer is probably they should talk to their Advantage plan, because they could find out from their Advantage plan whether or not their coverage will change if they sign up for another dental plan, or how they will work with the dental plan if they sign up for one.
Thank you. I'm wondering about sort of the major decision between the Advantage programs and the original Medicare. Are there some simple questions you might ask yourself if you're trying to evaluate which way you want to go?
Definitely. So everyone's different. It's always case by case when people come into the office to get counseling. So it just depends on what they can afford, what coverage they're looking for, and everyone's different. And I always just talk about the comparisons between the two, because sometimes that matters to people. So if somebody is looking to travel a lot, it is recommended to stay with original Medicare, because you can take original Medicare around the United States and you can see a provider that accepts Medicare. And with the Advantage plans, you're definitely working with networks of providers, and some of them are HMOs where they're very strict. And if you see anyone outside of that network, you're definitely going to pay 100% for your own health. So it just kind of depends on what they can afford as well. So some people I've encountered can't afford Medigap plans or policies, so they end up just going with Advantage plans, because they're still responsible for Part B, but the Advantage plan is offering a zero premium. And then we would definitely go through what co-payments look like for them and co-insurances throughout the different services for that plan, and see if they like the numbers that they're seeing.
And if you're on a health management or an HMO, a health management organization, like say Kaiser, and that's worked for you fine in the past, that would be an Advantage program in your new life as a Medicare person, right?
Yes, definitely. So when people say that they are on Kaiser, or they've been on Kaiser, now they're getting on Medicare, we do go through all the options of the original Medicare, of the guaranteed right to purchase for the Medigap, and then the Advantage plans, because overall the decision is theirs to make. And so with those Advantage plans, when people decide to sign up for them, sometimes it could be because they have extra valued benefits on top of like benefits for vision, hearing, and dental. Some people actually like the idea that they get like a card every month and it gets refilled so that they can purchase things over the counter. So it just kind of depends on what the person is looking for, but we definitely go over all like different costs and possibilities of what they may pay out of pocket. And in every session, we do always do an assessment to see if somebody is qualified for extra help, or for even partial extra help for drug coverage.
So if I am looking for one-on-one advice, I know that here at the Senior Community Center, we have one of the authorized SHIBA volunteer or SHIBA experts from Helpline House. And I think actually they're training somebody else as well. So there'll be a couple of people who might be able to meet people here. And if you're interested, you can sign up by calling Helpline, and that you can either make a reservation to meet with the advisor at Helpline, or we have offices open here on Friday, and they'll set up appointments at the Senior Community Center. But you can also do this online, and I know that that PCHS itself does some of these one-on-ones. Can you tell me a little bit about other ways that you might get help, either over the phone or online or in person with Peninsula Health?
Yeah, so Peninsula Community Health is the local counseling site. for the SHIBA program in Kitsap County. We definitely do one-to-one counseling. It could be over the phone. It could be done on a virtual platform. And if somebody is interested, they can always call the different numbers. They can call the main SHIBA line that is given. They can call, we do have a local voicemail number that we usually give out to people. And what happens is that when they call, we go through all the numbers, we call them back to schedule appointments. So sometimes it does take us like 48 hours to get back to people, just depending, because sometimes there's only a few of us working on that call list. But we definitely will work with people and try to meet their needs. The only thing we can't do at this time is actually go out to homes and counsel people at their home. That's the only thing that we can't do at this time.
So I think the statewide number is 800-562-6900.
Yes.
And it's open from 8 to 5 Monday through Friday. And like you said, Elmarie, it's best not to call when you're right up against a deadline.
Yeah, definitely not. Because then what happens is you might end up having a gap in coverage, and paying for your health care during that time as well. So we always encourage people to start during their initial enrollment period, which is 3 months before your birthday month. And if you know that you're retiring, definitely start looking into it at least a month before you decide to retire.
Okay, well, those are all helpful. I don't know if the folks on the call have any other questions right now.
I'm reading, yeah, a few questions just on Part B as I get into it. Yeah, as you indicated, Part A just almost starts automatically. I did defer Part B until just recently, so mine technically kicks in next month. The one thing I think I was aware of, but became more aware of, is by deferring it, it will be a little bit more expensive. There'll be a set premium taken out of my monthly Social Security, for the Part B. And I think I'm understanding of that. One thing, and again, if I'm getting too specific for me, we can defer this, but I did also just receive something that an additional amount will be taken out of based on IRMAA, income related monthly adjustment amount. And that's a little bit out of the blue. I had not heard anything about that. Is that something pretty specific to me, or any comment you might have on that?
So the IRMA, the way that they calculate that is people who generally have higher income, when the Social Security looks into it, then they will eventually pay a little bit more for premiums for their Part B services. So they're looking at your tax return from 2 years prior, right? Now, if your income has changed drastically since then, or if you had made an amendment on that Social Security, then you're on that tax return for that year, you're definitely going to want to contact Social Security to see if they can reevaluate your income so that they can do an adjustment for you. But if you are actually somebody who makes a little bit more, you're going to end up paying a little bit more for that Part B.
Now that will that get adjusted every year? Because obviously my last 2 years of working, I probably did make more, but it will certainly go down.
So with that, if it's going to change every year, that I do not know. Social Security will be the one that you need to ask that question to. So from what I know is just the initial time that somebody contacts and how to answer that IRMA. But if you had any other questions, we do refer people to the Social Security because we don't really know anything further than that.
But he did raise the question of the cost of delaying the Part D. So if you right, there is sort of a penalty if you don't.
Part B, yeah.
Part B, I'm sorry.
So Part B, if you are paying a penalty, that means that you probably delayed it and you didn't have current employer sponsored insurance at the time. So, and even if you did at the time and you delayed it, and then later on you lost it, but then you still never got on Part B, that may be actually why you're paying the Part B penalty. But the Part B penalty is based off of a 12-month period, and then it's calculated at 10% for that 12-month period. Now, if you didn't meet that 12-month period, you may not have to pay that penalty, but definitely if you met it, then you're on top of your premium, you're paying an additional 10% on top of that.
Okay, and I did not see it described as a penalty. I saw it described as a premium. And my understanding was that because I did not initiate B back then, and therefore I have not been paying into anything but A. That this is just a
yeah.
catch-up.
Yeah, so also another thing to keep in mind, if you did have group health insurance and you delayed Part B, usually when you sign up for Social Security, sign up for Part B later on, there's a form to actually sign to show that you've had coverage. So if you didn't sign that form, but you actually did, then you would be able to contact the Social Security office again, but you have to fill out the form.
I did complete a form. And
You completed a form? Yeah, so you would definitely want to double check again with Social Security. Ask them to look at the documentation that you had submitted and to do a reassessment on your income to see if they're charging you the right price for premiums.
well, yeah, and my understanding is this, because it's the same premium for everybody that this applies to. It's $164.90, which again, I've been told is for everybody. This is not the IRMA. But
So
this is just the standard
in most
Medicare
cases, for most people, it is $164.90. But if they have higher income, then they do
that's the
pay.
IRMA.
That's the IRMA, yes.
Right. Yeah. So like I say, my big question is hopefully it will go down. So I will have to check with Medicare on that.
And then,
Okay. Oh, go ahead.
I did want to also say that during that time also, if you didn't have the Part D as in dog prescription drug coverage, then you also may have to pay a penalty on or a higher premium for the Part D as well.
So
Yeah,
this is the kind of thing that it makes a lot of sense to meet one-on-one. It sounds like and you can do that over the phone,
Yes.
or you can set up an appointment with somebody, as we talked about earlier. I'm wondering about if I have suspicions about Medicare fraud, or just questions about, how I think the program is working, or if I just, are you the right agency to start with those questions?
Yes, definitely. So if you're suspecting that there's fraud going on, you can definitely reach out. We do hear people out and ask them to explain the situation. And then what we do as a SHIBA representative is when we report back to the Office of the Insurance Commissioner, we can also report it to the Senior Medicare Patrol, which is and then they'll take a look at the case, and they will be able to determine whether fraud is going on, or, and look into it, investigate a little bit more.
So this might be something like you get a bill and it looks like you're being represented for services you didn't receive, or you're somebody's trying to reach out to you and give you services that you don't think you're covered for, things like that. And I'm thinking that we're, as the targets of these fraudsters, we play a big role in trying to shut down the operations before they get out of control.
Yes, that is true. And a lot of times we do ask people to also talk to their provider's office, because sometimes it's just human error. So sometimes we do encourage people to work with their billing department first, or their primary care provider's office, whoever is billing them, to see if they made a mistake. And then if they can't solve the situation with them, then they come to us. And then if they don't agree with some things that the provider is billing them for, they can probably file an appeal for that, because they don't agree with them not covering it, or that they're being charged for certain things that they're not getting. And then as far as fraud, we definitely report these things as a SHIBA representative, but people can also call the 1-800 Medicare number as well to report fraud. And we have had people in the past that actually had given their Medicare number out. So if the Medicare number is actually given out, sometimes that can cause issues with their coverage, and their coverage can actually stop. So it is very, we do try to get the word out about fraud and scams, because some people don't realize Medicare will never call you over the phone. Medicare, the IRS, Social Security office, they will never call you unless, of course, you have initiated the call first and then asked for a call back. Then that's when somebody would reach out. But a lot of people these days are getting calls saying that somebody's associated with Medicare, but that's actually a scam call.
Thank you very much for that. The 1-800 number for Medicare is, I guess, 1-800 Medicare.
Yes.
That's
Let me see.
That's pretty easy. So it's 1-800 633-4227. And then the SHIBA number again, do I have that here? Was 1-800 562-6900.
Yes.
And are there any other, I guess I could also mention your website, the Peninsula Community Health Services website, which is pchsweb.org.
Yes, and then SHIBA also, so we also have a local SHIBA voicemail number that people can call. That number, it is 360-475-3095. So that is a voicemail number. They just leave a message, we'll call them back. They can leave their name and their number. And then, let's see. I did want to let people know that for Peninsula Community Health Services, the SHIBA representatives there are called navigators. So if you do make an appointment there, you do not have to be an established patient. We do see everybody in the public. So we welcome people to come and get one-to-one counseling if they do need it.
Great, thank you. And if you'd like to have an overview, sort of what we did today, but in more detail with pictures and circles and arrows and all that kind of stuff, there will be a presentation on Thursday, May 18th from 3 to 5 here at the Bainbridge Island Senior Community Center, and also at the Paulsbo Library on July 20th from 3:30 to 5. You're encouraged to make a reservation for coming to the Senior Center event at 3 on the 18th, but it's not necessary. But you are required to make a reservation to go to the Paulsbo Library, and I think you can do that off of krl.org, the Kitsap Regional Library website, and that's for the July 20th get together. I really appreciate your time, Elmarie. Is there anything else you want to leave us with?
Nope. I thank you for inviting me to this call, and I encourage everyone. So some people might have different questions because there's so many different kinds of scenarios out there. We encourage you to make one-to-one appointments. We can help you over the phone, in person, and we look forward to helping the community out.